You're finally ready to start talking about estrogen and consider taking it, but you don't know where to start and which one to go with. Hi, I'm your local OBGYN. I love women, so let's talk about it. Estrogen comes in a lot of formulas, and what I mean by that is that you can do a pill that you take orally, you can do a spray, a cream, even things that you implant and or rings. And it's really tricky to know what's the right one for you because most of us, the only exposure or knowledge that we have about things with estrogen in them have been our birth control methods, maybe in our younger years. But when we're talking about hormone replacement therapy, it is not a one size fits all, and there have to be considerations based on your medical history. The most affordable option right now is usually the estrogen pill, and it comes in a few different doses. It's pretty cheap. However, it comes with the caveat where when you take it orally, it goes through your liver, and that's called first pass. And with that, it does have an increased risk of blood clots that can occur by taking oral estrogen. Most of the newer studies look at estrogen that goes into your system in a different way because then you skip the liver and you don't increase clotting factors, which can cause a clot somewhere. We very commonly recommend the transdermal approach, and there are several different forms that you could consider. The one that I probably prescribe the most is the transdermal patch, which is changed twice a week. You get a dose, you hope that it kind of keeps you consistent for the 3.5 days that you wear it. Some people start to see a little dip in the estrogen when you get to the end of your 3.5 days, which makes it okay for some people, but some people break through with more symptoms at the end of their patch just before they're supposed to change it. And that's where, when you talk about sprays or gels that you apply to your forearm nightly or daily, whatever you want, you get a more consistent dosing because you're applying it every day. So you can kind of stay at like a steady state level of that medicine. There are injections that are used every once in a while, depending on people's intolerances. Pellets, don't do the pellets. The pellets are very difficult to dose. It's hard to know what's the right and the wrong dose, and you can overshoot it significantly. And then there are rings that we can place in the vagina that you can leave in for a long time that can help with genitourinary syndrome, which means that you don't have to put something in regularly to supplement that area, or all the topical creams or suppositories that you can put in the vagina, again, for treatment of that area over time. Now, the ones that usually go in the vagina do not increase to your whole system the amount of estrogen. So everybody's symptoms have to be taken into consideration. Cost can come into it, insurance, but there's usually more than one option that's available at a reasonable price for you.